Hi guys, it's Dr. Blackett with Yada Yada Health. Today we are talking about preeclampsia and if you are at risk. What is preeclampsia? Usually increased blood pressure with signs of damage to certain organs in our body, your liver, your kidneys, your brain. It can be very serious if left untreated. How do you know if you have it? At your prenatal visits, your blood pressure will be measured. After 20 weeks, we start checking your urine every time you come to look for signs of protein. If we see anything that's concerning, then often we'll do some blood work, or we may ask you some more detailed questions about how you feel. With preeclampsia, you can get a lot of swelling, you can get some headache, and some vision changes. Now, in pregnancy, we get some swelling. Swelling by itself is not a good indicator, but swelling associated with high blood pressure and protein in your urine is an indication of preeclampsia. I mentioned some vision changes. You can get those as well as some upper abdominal pain. So if you're having any problems like that, be sure to mention it to your doctor. What are some risk factors for developing preeclampsia? If you've had preeclampsia before, if you have a history of hypertension or high blood pressure when you're not pregnant, if this is a new father of your baby compared to your previous children, then sometimes we'll see preeclampsia. Your age can be a factor, as well as your race, if you're having twins or triplets, or if it's been an infertility pregnancy and you had IVF. Those are all factors that can sometimes predispose you to preeclampsia. When should you see your doctor if you think you have it? Anytime you have any of those symptoms, you should follow up. We'll usually have you come in the office where we can check your blood pressure and your urine and perform an exam to see if anything serious is going on. What will happen if I have preeclampsia? Well, it depends really on what point you are in the gestations. If you're very early and we're concerned about a premature baby, depending on how sick you are, then we may actually watch it. If we limit your activity level, if we have you rest, if we're able to keep your blood pressures down in a good place. But it really depends on how sick you are. It would require often staying in the hospital and monitoring the baby frequently. If you're usually within at least a month of your due date, when you're diagnosed with preeclampsia, the cure is delivery, and we often move that direction. If I have preeclampsia, does it mean that I have to have a C-section? Not necessarily. If everything's going well and the baby is doing just fine, then we can usually induce you and try to have a vaginal delivery. If you are very sick or there's signs that the baby is not doing well, then you may have to have a C-section. Do I need to do anything different in future pregnancies to prevent preeclampsia if I've had it before? They actually have some good studies now that support the use of low-dose aspirin taken daily during pregnancy to help prevent preeclampsia. If you've had that history in your previous pregnancy, be sure to bring that up to your doctor or your midwife or whoever's managing your subsequent pregnancies, and they'll likely recommend that you take that daily aspirin, 81 milligrams, every day during the pregnancy to help keep it away. Thanks, guys.